If you are missing out on life because of a hearing loss, it's time you stop ignoring the symptoms and get the help that you need. May is Better Hearing Month and the perfect time to take those steps to get your hearing checked. Joining me now is Dr. Joseph Hall and Dr. Candace Biltz, both with Hearing Health Solutions. Welcome to both of you. It's nice to see you guys.
Thanks for having us.
Thank you. Wonderful that there's a whole month dedicated, Candace, to this because we know that it's important. And we talk about older folks losing their hearing, but apparently you're seeing younger and younger people too.
Hearing loss can affect everybody, from brand new babies to the very, very old. We're seeing people stay so much more active than we ever have before, particularly baby boomers. They're working longer, they're staying active, busier. So it's important to keep people hearing well to maintain a high quality of life.
So Joe, why do you think that more and more people are losing their hearing at an earlier age?
It's a great question, and a lot of studies have shown that to be the case. A lot of younger folks are obviously participating more in using the earbuds and headphones.
Yep.
A lot of hearing loss that we're seeing in younger people. So hearing protection is certainly a key, and so we're seeing a lot of younger people coming in for hearing loss.
And yet it's the older folks, Candace, that I know are kind of resistant to even going in and having it checked. They will pretend they hear when they don't. So, and I know this was the case for my father too. You know, we really had to convince him to go get his hearing checked. How do you get someone into the office just for that checkup?
Sure. I always feel like the people that are, their family pulls them in, kicking and screaming, they're never that excited to be there, and they never, do as well. So I think the best thing the family can do is be supportive. We want you to go and do this and enjoy with us, and we want to be able to talk to you. We want you to hear the kids better and help point out, where maybe they are missing things. Because I think especially family members, we have a tendency to just repeat. And then we're carrying the burden of other people's hearing loss.
They may not even realize it. They may not even realize it themselves, or how serious it is. Joe, I know there are a lot of answers to folks too. I mean, the hearing aids of today are a lot different than those devices years ago.
Absolutely. We see a lot of new, great technology, much smaller technology as well that can hook into Bluetooth, to a variety of technology.
There's a new made for iPhone hearing aid, which is pretty incredible. So we're seeing hearing aids get a bit of a cool factor.
That is cool. Well, what about other health issues that are related to hearing loss, Joe? What are some of those?
There are quite a few. The list is very extensive, certainly. We see a lot of high blood pressure, diabetes, those sorts of problems do contribute.
Really?
Absolutely. And we see a lot of that because of the decreased blood flow to the ears. And so over time, it takes its toll and causes some hearing loss. And so we see a lot of older folks with those problems who have hearing loss as well.
And then what about on the other side of that, Candace? Maybe some emotional or mental health issues that go along with hearing loss?
Unfortunately, studies have shown that individuals who do have untreated hearing loss are at a higher risk of quicker cognitive decline. We also see people become more socially isolated. They don't like eating in that restaurant or visiting, with whatever social group or church meetings, things like that. So then they quit going, and they get, have a tendency to get a little bit more depressed or a little bit lonely. So
I was going to say, they stay inside. They don't want to, because they can't communicate, right?
They can't hear well, so they don't enjoy it as much.
What should someone do then if they see some of these symptoms themselves, Joe?
They should obviously see what kind of things that they're missing in their day-to-day activity. They should talk with those around them to see if it seems that they're missing more than they can tell themselves. And then obviously we like to check those people to see if they are having hearing issues, to evaluate their ears, to see if there's something more going on. Obviously, if they're having sudden hearing loss or other problems, drainage from the ears, ringing, things of that sort, also we want to evaluate them.
Those are big signs, yes.
Absolutely.
And Candace, I know you have an incentive to try to get people in to see you.
We do.
What is that?
We do. All next week, Hearing Health Solutions is offering individuals a free hearing screening and tinnitus screening. At that appointment, there's a lot of devices now that have things in them to help relieve ringing in the ears. So if someone was to get a device next week, we're offering a complimentary additional year of warranty.
No better time than the present to get that done. Candace, Joe, thank you so much. Nice to have you.
Thanks for having us.
Thank you.